Hello, my name is Kim Deckman. I'm a speech-language pathologist. I work in early intervention most of the week, birth to 3, but also do preschool through 12th grade at a small rural school in Mendocino County. I came to Len because I was looking to improve services in my rural area, and this project is an attempt to do that. So the title of my presentation is Training Paraprofessionals in Evidence-Based Strategies for Autism, a pilot of using Project ImPACT in preschool settings. I have no disclosures other than I'm employed at the Mendocino Office of Education. So some background and rationale. When teaching adults new skills, research and implementation science is increasingly showing us that coaching, a process that's personalized, it's ongoing with a facilitator where they provide feedback, they model skills and support practice in real time, is much more effective than consultation models, an approach that usually involves providing expert advice without sustained follow-up. Speech-language pathologists are frequently asked to consult in preschool settings for paraprofessionals and preschool teachers. And SLPs might more readily switch from a consultation model to a coaching model if they have a structured, manualized curriculum to guide them. Furthermore, since paraprofessionals spend much more time with children with ASD than SLPs during the school day, building paraprofessional skills is essential for improving outcomes with children with ASD. This study was developed because I wondered whether the Project ImPACT caregiving coaching curriculum, which is intended for use in homes with parents, could be adapted to become a coaching curriculum in training paraprofessionals. If effective, it could offer a practical, scalable way that SLPs could use to improve outcomes in similar educational settings. Why would we choose to use Project ImPACT for this purpose? Well, it has several things to recommend it. One, it teaches naturalistic developmental behavioral interventions, or NDBIs, for children ages 2 to 5 years. It contains manualized lesson plans, and those lesson plans have visual supports for the skills that are taught. It has been established as evidence-based practice, and I was very familiar with it because I use it weekly in my early intervention practice. So which gap in the research does this address? Well, I found one study, Mercheco et al., which examined whether Project ImPACT could be adapted to train home-based therapeutic staff. And they found that it increased their skills in using evidence-based practice, as well as increased the children's spontaneous communication. And so this study extends that work by looking at its adaptation for a site-based program. So my research question was, will Project ImPACT increase site-based preschool paraprofessional staff use of evidence-based strategies to fidelity when interacting with preschool students with autism? And what aspects of that training did the paraprofessionals find most valuable? My methods involved recruiting 2 paraprofessionals from a preschool in Mendocino County. One was a classroom-based aide, and the other was an SLPA, a speech-language pathology assistant. With regard to data collection, I gave them a pre and post survey. The survey asked them about their comfort level in interacting with children with autism, their knowledge of NDBIs, as well as in the post survey, what aspects of the coaching they found valuable. I took a 20-minute video sample pre and post in which the paraprofessionals were interacting with a child with ASD in a naturalistic play environment. And then we set aside 5 minutes of that video and coded it for fidelity of use of the strategies that were coached. The intervention involved 2 months of 1 to 2 times weekly coaching sessions. The sessions were 30 to 45 minutes in length, and they followed the order of the lessons in the Project ImPACT curriculum. The structure of the sessions involved me introducing a new skill at the beginning to the paraprofessional. I would then model that skill with the child with autism in the preschool setting. The paraprofessional had time to practice the skill that was introduced with live feedback from me. Then we would step back and have some reflection on how that went and make a plan for how the paraprofessional would practice that skill in the upcoming days and weekend. The skills that were coached fell into 4 categories. The first was to follow the child's lead, involving imitating the child. The second was to adjust your communication such that they would become more animated with their language and their gestures, to create opportunities for the child to communicate, and then to teach new skills involving teaching to use naturalistic words and prompting hierarchies. In order to code the fidelity of the videos that we took, we used the fidelity checklist from the curriculum itself. Fidelity is defined as the degree to which intervention and instruction method is delivered as it was originally designed or intended by the developers. The skills that we saw in the videos were rated on a scale of 1 to 5, being 1 not very used to not very high fidelity to 5. This is our data. The blue is pre-intervention, the red is post, and you can see that the rate of increase of fidelity of skills touched increased for almost all of the skills that were coached for both paraprofessionals. This is a video pre-intervention of one of the educators. Pay attention to the quality of the interaction with the child and the educator. Okay, so in this video, the educator is being rather quiet. They're not providing any language modeling. They're positioning a little to the side. They're not taking turns with the child. And when they do take a turn in the play interaction, it's to be directive. So now we'll look home.
Up, down. Have the block. Oh. Oh, wow. Block, down. Block, down. Push. Oh, you're going to line them up. Block. Block on top. Block on top. Oh, you don't want that block on top. You want the block next to it.
Okay, so in this example, the educator is using a lot of simple language models. They're imitating the child. They're following the child's lead, helping them with their ideas. They're more animated, and then they create an opportunity for the child to communicate by doing what's called playful obstruction. And when they do that and the child looks right up at her, they expand her communication. And so this is a considerable increase in this paraprofessional skill. So in conclusion, we found that the project ImPACT curriculum could be adapted to effectively train site-based paraprofessionals to use evidence-based strategies. And our qualitative data showed us that the staff valued the coaching model and felt more effective in their teaching. A few notes of discussion. This project took significant buy-in from the administrators, the lead, as well as the lead teacher. But even at that, the lead teacher got a little frustrated with me at taking the paraprofessionals time twice a week at 45 minutes, a time off on the floor, but still her attention. So I recommend in future implementations that perhaps limiting the coaching session to once a week and doing some of the skills training outside of the classroom time so that the coaching time was less. Also, a note, the parent had significant buy-in because they had received this training in the Early Start program in our county, and they wanted their child's preschool providers to also have the same skills. And it was really nice because then we had like this community of practice amongst the parent, the SLP, and the paraeducators, and we're all using the same language about which intervention strategies we're using. So lastly, I just raised some thoughts about future directions. I think we should try to standardize ways that we're training paraprofessionals, in that to get as many people as coached as we can, in that I think we should consider what works best. I use the Project ImPACT curriculum, but we might as well have tried to adapt the Help Us in Your Hands curriculum. There are other resources, but we should actually research which of those work best in increasing people's skills. We should also ask who is best positioned to provide that coaching. SLPs seem well positioned, but we also might consider specifically hired district employed coaches, program specialists, or preschool education, special education preschool teachers. And lastly, I would invite some of these models to develop site-specific curriculum for coaching. I know that a lot of these models have like training programs in becoming coaches, but those often come at significant cost and time investment. I really appreciate the Help Is in Your Hand models, which is giving coaching resources for free. So we need a site-based version of that to help increase paraprofessional skills. Thank you to the study participants, to Dr. Heather Thompson and Dr. Yu, who helped me significantly, and also especially to Early Start Mendocino, who was very patient with me as I took a lot of time away to participate online too.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.